10 proven ways to shrink your enlarged prostate naturally. They say it's just part of getting older. The frequent bathroom trips, the weak stream, the pressure that won't go away. But here's the truth they never tell you. An enlarged prostate isn't just inevitable, and it's not untreatable. Because right now, millions of men over 40 are struggling silently with symptoms that could be reversed. Naturally. And yet no one's talking about the science-backed solutions that actually work, many of which are sitting in your kitchen right now. In fact, some of them have been shown to shrink the prostate better than common medications, without the side effects. This isn't about guesswork. It's about clinical research, proven interventions, and 10 powerful tools that could change your life, if you know how to use them. And one of the most effective remedies? It's hiding in plain sight, and we'll reveal that near the end. Welcome to Holistic Habits, the place where we cut through the noise, expose outdated advice, and bring you the best of natural health with no fluff. So if you're ready to take control of your health, reduce those frustrating symptoms, and finally feel normal again, make sure to subscribe, because we release new videos just like this every single week. Now let's get into it, starting with a food that could protect your prostate and even prevent cancer. Number 1. Lycopene-Rich Tomatoes, the antioxidant that can freeze prostate growth. This everyday food might be your prostate's best-kept secret. Tomatoes are packed with lycopene, a red antioxidant that builds up in prostate tissue and helps protect cells from damage. But it doesn't stop there. Lycopene may actually freeze prostate growth in its tracks. In one 6-month study, men taking 15 milligrams of lycopene daily saw no further prostate enlargement, while the placebo group's prostates continued to grow. Lycopene users also had lower PSA levels and better urinary symptom scores. The key? Cooked tomatoes. Heating unlocks more absorbable lycopene, over 50% more bioavailable than raw tomatoes. Think tomato sauce, paste, soups, or roasted dishes with olive oil. Mechanism-wise, lycopene helps lower DHT, the hormone that fuels prostate growth, while reducing inflammation inside the gland. And it might do even more. Studies show men who eat more tomato products have fewer aggressive prostate tumors. So if you've been skipping tomatoes, it might be time to rethink it. Next up, a common drink with compounds so powerful they can slash prostate symptoms by over 30%. Number 2, green tea. Polyphenols that reduce inflammation and symptoms. Green tea is often called a super drink for men's prostates. It is loaded with catechins like EGCG, which are potent antioxidants and anti-inflammatory compounds. These green tea polyphenols help combat chronic inflammation and may modestly inhibit 5-alpha reductase, the enzyme that produces DHT, thereby slowing prostate growth. While research on green tea and BPH is still emerging, results are promising. A notable clinical trial gave BPH patients a concentrated green and black tea extract, a surety, for 12 weeks. Men taking the high-dose tea extract saw their urinary symptom scores plummet by 34.5%, American Urological Association score, and had improved urine flow rate and less leftover urine in the bladder. Inflammation markers like C-reactive protein also stayed lower in the tea group. Such improvements within weeks suggest that green tea can rapidly relieve BPH symptoms. Even simply drinking green tea daily may help. It has known immune-boosting and chemoprotective effects for the prostate. Tip: swap out coffee for decaf green tea if nighttime urination is an issue, since caffeine can worsen urgency. Aim for about 3 cups of green tea per day, or consider a decaffeinated green tea extract supplement for higher catechin intake. Fun fact: in one study, sedentary men who started drinking green tea had not only better urinary function, but also an unexpected side benefit: improved brain function and lower cholesterol. Coming up, the crunchy seed that's more than just a snack. It could rival some medications in relieving prostate pressure. Number 3, pumpkin seeds. Zinc and phytosterols to ease BPH symptoms. Crunchy, satisfying, and surprisingly potent. Pumpkin seeds are more than just a snack. They're one of the most effective natural tools for shrinking an enlarged prostate, backed by both tradition and science. These seeds are rich in zinc, a mineral concentrated in the prostate that helps regulate testosterone and limit its conversion to DHT, the hormone behind prostate growth. They also contain phytosterols, plant compounds that reduce inflammation and slow prostate cell proliferation. In a year-long study of 100 men, those taking pumpkin seed daily had a clinically significant drop in BPH symptoms, with 58% showing measurable improvement compared to 47% on placebo. Another study found that pumpkin seed oil improved urine flow and reduced nighttime urination as effectively as tamsulosin, but without side effects. Zinc likely blocks 5-alpha reductase, while phytosterols reduce swelling. Pumpkin seeds may also mildly support bladder emptying, easing retention. And because their phosphorus is poorly absorbed, they're generally safe even for those with early kidney issues. Bonus insight: combining pumpkin seed oil and saw palmetto improved BPH symptoms by over 40% in just 3 months. Again, with no drop in libido. Try a daily handful of raw seeds or use cold-pressed pumpkin seed oil on meals. It's a small change with big benefits. Coming up, a fatty food that targets prostate inflammation at its source by changing your blood. Number 4, fatty fish, omega-3s. Anti-inflammatory power for prostate health. If you're serious about shrinking your prostate and cutting nighttime trips to the bathroom, what you eat for dinner might matter more than you think. Fatty fish like salmon, mackerel, sardines, and trout are rich in omega-3 fatty acids, and those omega-3s are powerful inflammation fighters. Since chronic inflammation is one of the hidden drivers of prostate growth, reducing it can bring serious relief. In fact, men who eat cold water fish once or more per week have been shown to have a significantly lower risk of developing BPH and less chance of needing surgery. Omega-3s like EPA and DHA calm down inflammatory messengers inside the prostate, improve blood flow to pelvic organs, and help regulate hormones like DHT and estrogen, both of which influence prostate size. There's more. Omega-3s also help maintain a healthy weight, and studies show that obesity is a major risk factor for BPH. So by eating fatty fish, you're fighting prostate growth on multiple fronts: inflammation, hormones, circulation, and weight. And the benefits don't stop there. Omega-3s also boost heart and brain health, reduce joint pain, and improve energy. To get the full effect, aim for 2 servings of fatty fish per week, or consider a high-quality fish oil supplement if fish isn't your thing. Next up, a centuries-old herbal remedy that's still used across Europe to shrink the prostate, without the side effects of drugs. Number 5, Saw Palmetto, the natural DHT blocker, used by millions. If you've looked into natural prostate support, you've probably heard of Saw Palmetto. But here's what most men don't realize. This small palm berry contains powerful fatty acids and plant sterols that act as a natural 5-alpha reductase inhibitor, the same enzyme targeted by prescription drugs like finasteride. That means saw palmetto can reduce levels of DHT, the hormone that drives prostate enlargement. And the results? In clinical trials, men taking saw palmetto often report stronger urine flow, fewer bathroom trips, and less straining, especially at night. One study even found it reduced prostate volume and improved symptoms with fewer side effects than pharmaceutical options. In fact, across Europe, saw palmetto is so trusted that over 90% of BPH treatments in Germany are plant-based, with saw palmetto leading the pack. Still, not all supplements are created equal. For best results, choose an extract standardized to 85–95% fatty acids and sterols, and give it at least 8 weeks to notice full effects. It may not work for everyone, but for many men, it's a gentle, effective first step towards shrinking their prostate naturally. Up next, a lesser-known plant compound that rivals prescription drugs for improving urinary flow, without the hormonal side effects. Number 6, Beta-Sitosterol, the plant compound that acts like medication. Beta-Sitosterol might sound like a pharmaceutical, but it's actually a natural plant sterol found in foods like nuts, seeds, and avocados. And when taken in concentrated form, it can dramatically improve BPH symptoms, without the side effects of traditional drugs. In fact, one Cochrane meta-analysis concluded that beta-sitosterol significantly improves urine flow rate, bladder emptying, and overall urinary symptoms in men with enlarged prostates. On average, men had a 5-point drop in symptom scores and 37% less residual urine, a clear sign their bladders were finally emptying more completely. What's more, it works without shrinking the prostate itself. Instead, beta-sitosterol appears to relax the urinary tract, reduce inflammation, and possibly lightly inhibit DHT production, improving function without major hormonal shifts. And it's incredibly well tolerated. In long-term studies lasting up to 18 months, men taking beta-sitosterol had no serious side effects. You can find small amounts in food, but supplements deliver the therapeutic dose shown in studies, usually around 60 to 130 milligrams per day. Coming up next, 2 traditional herbal extracts that have quietly been used in Europe for decades, offering surprising benefits for men struggling with frequent nighttime urination. Number 7. Pygeum and stinging nettle. European remedies with real results. You've probably never heard of Pygeum africanum or stinging nettle root, but in countries like Germany and Austria, they're prescribed more often than pharmaceuticals for BPH. Why? Because these herbal extracts consistently deliver real-world results, without the side effects many men fear. Let's start with Pygeum, an extract from the African plum tree bark. It's rich in fatty acids and sterols that reduce inflammation, slow growth factors in the prostate, and improve bladder contractility. In a meta-analysis of 18 clinical trials, men taking Pygeum were twice as likely to report symptom relief than those on placebo. They saw 19% fewer nighttime urinations, 25% less leftover urine, and 23% stronger urine flow, all in just a few weeks. Then there's stinging nettle root, often used alongside Pygeum in European formulations. It works by blocking estrogen pathways and reducing DHT activity within prostate tissue, both key drivers of prostate growth. In one dramatic 8-week study, men taking nettle root saw their symptom scores plunge from severe to nearly normal. Other trials show it reduces prostate size and PSA levels. And the best part? Both herbs are generally well tolerated, with side effects comparable to placebo. But don't expect miracles overnight. These extracts often take 4 to 8 weeks to show full benefits. Choose standardized extracts for reliability. Pygeum with at least 100 milligrams of total sterols, and nettle root at 600 milligrams a day, the dose used in most clinical trials. Next up, the one intervention that costs nothing, requires no pills, and can slash your BPH risk in half. Number 8. Regular exercise, the free natural BPH therapy. Most men ignore. You don't need a prescription or supplement to start shrinking your prostate, just movement. Exercise is one of the most powerful yet overlooked tools for fighting BPH. Men who exercise regularly are 30% to 50% less likely to develop prostate enlargement. And if you already have BPH, staying active can significantly reduce symptom severity, improve urine flow, and delay the need for medication or surgery. Why does it work so well? Exercise reduces chronic inflammation, a key driver of prostate growth. It also helps regulate hormones, specifically lowering excess estrogen and DHT, which are linked to prostate tissue overgrowth. Plus, it improves pelvic circulation, reduces abdominal fat, and relieves the pressure that comes from long hours of sitting, all of which play a role in prostate health. In fact, one study found that men who walked briskly for just 3 extra hours a week cut their risk of BPH progression by 10%. More intense routines like cycling, swimming, or even manual labor can deliver up to 50% lower risk. But here's a shocking twist. Sitting too much can cancel out your workouts. Men who watched 40+ hours of TV per week doubled their risk of BPH, even if they also exercised. Bottom line, get moving daily. Even 30 minutes of moderate movement can strengthen the bladder, balance your hormones, and ease those frustrating symptoms. Coming up next, a muscle group you've probably never trained, but strengthening it could drastically reduce nighttime trips to the bathroom. Number 9, pelvic floor and Kegel exercises strengthen your internal prostate defense. Most men never think about their pelvic floor muscles until those midnight bathroom trips or sudden leaks start interfering with life. But here's the surprising truth. Strengthening these deep hidden muscles can dramatically improve bladder control and relieve pressure from an enlarged prostate. Kegel exercises target the muscles that control urination, helping you empty your bladder more completely and reduce urgency, dribbling, and overflow. They're especially effective when the prostate is enlarged and pushing against the urethra, because strong pelvic muscles can help override the blockage. Clinical studies back it up. Men who performed Kegel training for just 12 weeks saw significant reductions in symptom severity and night urination, without medication. And those who had BPH-related incontinence or difficulty stopping urination often regained control by consistently doing these exercises. Here's how it works. Tighten the same muscles you'd use to stop urinating midstream. Hold for 5 seconds, then release. Do 10 to 15 reps 3 times a day. Over time, this strengthens your urinary sphincter and helps stabilize bladder signals, making you less likely to leak, dribble, or sprint to the bathroom. And the best part? No equipment, no side effects. Just quiet, private training with powerful results. Next up, a nighttime remedy that helps your prostate shrink while you sleep. And it's probably missing from your routine. Number 10, quality sleep and melatonin. The overnight fix most men ignore. You might not realize it, but what happens while you sleep could be the missing key to shrinking your prostate and regaining control over your nights. Here's why. Poor sleep doesn't just leave you groggy. It disrupts the delicate hormonal rhythms that regulate prostate growth. Specifically, low levels of melatonin, your body's sleep hormone, have been linked to increased DHT production and worsened urinary symptoms. And since most men with BPH already struggle with waking up to urinate, this creates a vicious cycle. Fragmented sleep leads to hormonal chaos, which fuels further prostate enlargement. But there's hope. In clinical trials, men with BPH who took a low dose of melatonin before bed saw meaningful reductions in nighttime bathroom trips and reported better sleep quality overall. The research suggests melatonin not only improves rest, it may slow down prostate growth at the source by reducing inflammation and countering hormonal imbalances. And you don't always need supplements. Avoiding late-night fluids, keeping your bedroom dark and cool, and maintaining a consistent bedtime can naturally raise melatonin levels. But if nocturia is stealing your sleep, talk to your doctor about low-dose melatonin. It might be a simple fix with outsized benefits. Let's wrap this up. A healthier prostate starts with one choice. By now, you've seen the truth. Shrinking an enlarged prostate isn't just about pills or surgery. It's about giving your body what it actually needs to heal. You don't have to overhaul your life overnight. But if you start with just one of the habits from today's list, whether it's adding Lycopene-Rich Tomatoes, starting Kegels, or swapping coffee for green tea, you're already turning the tide in your favor. And here's the part no one talks about. These habits don't just relieve urinary symptoms. They support hormonal balance, reduce inflammation, and often improve everything from sleep to sexual function. The prostate may be small, but its impact on your quality of life is enormous. So now let me ask you, have you tried any of these strategies before? Did something in today's video surprise you or hit close to home? Scroll down and share your thoughts in the comments. I personally read every one, and your story might help someone else. And if you got value from this video, do me a quick favor. Hit the like button and subscribe to Holistic Habits. We're here every week with research-backed strategies to help you take control of your health. Naturally, take care of yourself and take action. Your prostate and your peace of mind are worth it.